Hi, everyone. Welcome back to Clinician's Brief, the podcast, where we bring you the conversations behind our clinical content. I'm your host, Dr. Alyssa Watson, and today I'm joined by Dr. Andrea Eriksson De Rezende. She's a board-certified veterinary cardiologist with Blue Pearl Pet Hospital in Charlotte, North Carolina. We're going to be discussing one of her recent cases. This was an indoor domestic short-haired cat that had a newly detected murmur, but a history of limb lameness. And ultimately, the diagnosis on this kitty was stage B2 hypertrophic cardiomyopathy with a left atrial thrombus. So a lot going on in this little kitty. And she is here to kind of walk us through how early detection, as well as low stress patient handling and targeted therapy really helped guide management in this case, but also how these principles can be applied more broadly to HCM cases and thromboembolic disease in cats. So, hi, how are you doing this morning, Doc? Thank you
I'm
so much for
good.
joining us.
Oh,
Yay!
thank you for having me. I'm honored.
Well, yeah, I know it's a really busy time of year. So, and we're really excited to have this conversation. Before we jump kind of into the case, would you just give us a little background, tell the audience a bit about your veterinary journey?
Oh yeah, so I'm originally from Oregon, and that's where I went to vet school. So in Corvallis, and then I was lucky enough that I was able to go and do my residency at NC State, and had an amazing time at NC State, and I got to teach a little bit after that at Virginia Tech with incredible folks, and then found my way through New York City and then now back down to North Carolina. So I love what I do, and can't imagine doing anything else.
That's wonderful. Since coast to coast, it sounds like you've been.
Yes. Yeah. Yes.
Awesome.
Yeah.
All right. Well, I'm super excited about this talk today. So these are definitely things, certainly when I think about my years in practice, thromboembolic disease, saddle thrombus in cats is something that has always been, generally ends up with a poorer prognosis. And so I was, when I read this case and found out that some of these can actually have good outcomes, that was nice. So can you start by walking through this patient's initial presentation and what really stood out to you about the history and the examination when you first saw the kitty?
Yeah, so with these particular types of thromboembolic cases, the you've got the classic that everybody dreads, where it's the kitty that's completely cold and can't use their back limbs, and then we have these kind of strange ones where the owners will come to me with their kitty and they're like, "Yeah, we're here for my veterinarian heard a murmur and they said that I probably should get it checked out. We maybe need a dental or something." And then you talk to them about, I ask them every single time, even though they don't provide it right away, like, have you ever noticed like any sort of unusual pain, anything that seemed to be like they fainted? Because it's really funny how some people will be like, "Oh yeah, no, about a year ago he did," and I just thought, "Oh, okay, well, like that's not normal." So, just so you know, and so they will have like weird neurologic episodes, and so this kitty was definitely one of those where the owner was like, "Oh yeah, it was weird where where." The kitty basically had this period of time where, and this is not unusual, where they'll be dragging a limb and the owner thinks, oh, they must have fallen off the couch or they jumped up on the refrigerator and hurt themselves, especially if it then goes away, and so that always piques my curiosity to say, okay, maybe this was not, because cats are so agile. I mean, they jump, we see what they can do without hurting themselves. And so the fact that this kitty had something where it was like, no, that seemed like a painful event, and this very well could be linked to this underlying heart murmur, and the fact that we need to make sure that this is not the heart, or it is the heart. So
Yeah.
yeah.
Yeah. Not super surprised that sometimes something that big would be left out of a history. I'll tell you, I I multiple times a year have owners where I am about to give a vaccine and I say, any history of vaccine reactions, that you're aware of? And they'll go, oh yeah, we went to the ER last year. He almost died. I'm like,
Like,
thank you for telling me.
yes.
Stop. Back
Yep.
up a
I
second.
know. Yep. It's not normal. Yep.
So for general practitioners like me, because when a cat comes in with a murmur, because just like you said, a cat will come in for a dental or something, we'll hear a murmur. And in a dog, when I do that, I'm fairly confident about what's going on. If it's a little dog, I'm thinking mitral valve disease. If it's a larger dog, I'm looking at some of these other disease processes. But when a cat comes in, I'm quite a bit more unsure about whether that murmur is an issue. So when we have a murmur, when we have vague signs, what are some red flags that should raise suspicion for me that we do need to push for more of a workup for cardiomyopathy?
Sure. So, yeah, this is great. So, obviously, this is the ideal, because there are plenty of these kitties where I definitely talk to family vets and, something happened, under anesthesia, and they're like, there was no murmur, there was no gallop, Andrea, there was nothing. And I'm like, that happens. And I'm sorry that it does, because they're cats and they're put on this earth to make us humble, is what it is. So, but typically, so the louder murmurs are going to be the ones that I am going to be more concerned with. So the soft murmurs that are, say, like the grade 2 murmurs, those 50-50, it's like, it could be nothing. That there are certainly kitties with low grade murmurs, just because of their sympathetic activation. They will have a low grade murmur in the hospital, and then I get to echo them and say, "Yay, it's just benign." But those that have a louder murmur, say like a grade 4 murmur, that you're like, yeah, that's pretty firmly there. Those are ones where I think we need to, dig into that a little bit further, rather than just, not that anybody would push it off to the side, because I know we all worry about these kitties. The other would be if there is a gallop sound. So a gallop sound is, it's unusual for a kitty to have a gallop sound, just because, a gallop sound can occur because they, like a lot of us know, they're hyperthyroid or they're hypertensive, but that needs to be investigated as well, because those diseases can cause underlying cardiac conditions that are secondary, and they can be quite severe. So it's something that, regardless of being genetic hypertrophic cardiomyopathy versus hypertensive heart disease or thyrotoxic heart disease, still needs to be kind of delved into with that patient. The other would be, it's unusual for a young kitty, say like a male kitty, 5 to 7 years of age, to have an arrhythmia. Like, it's really, that is not something that is where, where we think, oh yeah, kitties just get arrhythmias. If they're throwing VPCs, you're listening and you hear, a regular rhythm and then a pause, because usually our ear picks up the pause. That also gets piques my interest, because that is not something that I think of as like, oh yeah, sometimes young cats just have arrhythmias. They typically have something going on if they're throwing some VPCs. The older kitties that have, say, like the 17-year-old kitty that has maybe GI disease or something, where they're, whether it's IBD or lymphoma, those kitties can have arrhythmias just because of their underlying like systemic disease. We oftentimes will check them out just to make sure, especially before they get steroids or something of that nature. But those are kind of the main things. So say a young cat with an arrhythmia, a gallop sound always worries me. That's not something I ever want to ignore. And then a cat that has a louder murmur. And so those are ones that, even if an owner says, hey doc, I'm just not going to go see the cardiologist and get an echo, at least like an NT-proBNP for those are, that's where that diagnostic test actually performs really, really well. It's not going to perform so well that it tells you like mild, moderate, or severe disease. So I can't tell you, hey, if the number's 800, it's going to be severe. They unfortunately, it won't tell you that, but it will tell you if that number is elevated, more than likely that kitty has underlying cardiomyopathy. And it may be just the information that you need to be able to tell that family, like, okay, are you sure you don't want to go get an echo? Because now I have an additional piece of information here that that can help, kind of maybe push them that way. I would say I have questions from my family vets about what about thoracic radiographs? Certainly with an NT-proBNP, and if you're able to get thoracic radiographs on those kitties, if they have a big heart, then they have a big heart. I mean, usually if you can see it on an x-ray where you're like, oh gosh, that's a big heart. Usually when I echo them, I'm like, oh Lord, this is bad. And so if they have a normal cardiac silhouette, as we all know, they could still have underlying cardiomyopathy or, secondary cardiac disease, but it's something that for sure those kind of scenarios should trigger a kind of a plan to investigate it further.
Right. That's actually really helpful because certainly something like NT-proBNP, I struggle knowing kind of where to put that in the hierarchy of my workup.
Yeah.
And, oftentimes, just like in the article you talked about in this case, diagnostics were really triaged. And sometimes we have to be very intentional and specific about the order we're doing these diagnostics in, or, using, low stress handling. Sometimes even just doing x-rays can kind of push these kitties. And so can you give any other tips about how you determine which tests to prioritize?
Yeah, and I mean, as we all know, this is gonna depend on a kitty, but an example I had yesterday where we had a kitty who had some very significant opinions, and it was there to see me for an echo, and I always want to get a blood pressure on my kitties, but this kitty definitely had opinions on that, and I said, okay, well, if I'm going to do something, they're here for me to echo it, so let's start there, and then if we are able to, maybe we can then get the blood pressure. So for, whether it's financial considerations or whether it's like this cat, we don't want to stress this cat because it could be detrimental. I mean, sadly, cats have died with the stress of the visit, which is always obviously devastating. And so, so for me, it's really not ever pushing that kitty to the point of being so stressed that I'm harming it. And so a lot of times that conversation with the owners is like, okay, we're going to have to talk about sedation. And if it is something that allows me to get the information for them, and I won't, for me, getting a set of chest x-rays, I don't want that to be the demise of the kitty cat. And so so that is something where one of my mentors that always told me, Dr. DeFrancesco, it's better to sedate than resuscitate. And so I always have that in my head from 20 years ago. And so it's in, what's nice now is that we know, this kitty, we couldn't necessarily benefit from gabapentin, but my goodness, that has been a game changer for us, for sure. Like where we, and thankfully my family vets that, especially the ones that see a lot of cats, will, they're like, hey, Andrea, I'm going to send it for this. Are you okay with me giving some gabapentin and I'm like, please do. That's amazing. And it helps so much. And so for me, it's kind of like, okay, what's the state of the condition of the patient? And honestly, too, of course, all of us as cardiologists, just because of our nature, we want to have this big, beautiful echo study. But there are times where I'm like, what is it that I actually need to know about this cat? And so like a kitty like this, it's like, I just need to visualize that left atrium and that left auricle, get a sense of what everything looks like, and then we can, back off. And so I can at least give the owners that information. So it's really, because sometimes even a blood draw is going to be the thing that is, and so that's where I find like NT-proBNP, while it's super helpful, sometimes that is something where it's like, no, we have to sedate to be able to get that information so that we don't stress the cat too much.
Yeah. Actually, that leads perfectly into my next question, which was, in terms of those pre-visit pharmaceuticals, obviously you've mentioned gabapentin. Do you have particular doses that you recommend when we give before they come to see you? And are there anything else? Do you have any other kind of ones that you reach for that you feel are effective but still safe for these patients?
Yeah, so I would, to start with the gabapentin, as we all know, there are some kitties that 50 milligrams the night before and 50 milligrams the morning of is perfect, and it just takes the edge off of them. And then there's some
And then there's
where,
T-Rex kitty,
yeah,
where
where you're
300
like,
milligrams
that's
doesn't
exactly
touch it.
right. I mean, I have done that where I'm like, you got 600 milligrams of gabapentin and you still are kind of angry at me. So I remember I worked with Dr. Bonzinski, who's a veterinary surgeon, when I worked in Paramus. And there was one kitty I was just like, I can't, I'm like, I really can't even inject this cat. Like, I can't get near it. I don't know how to do this, you know? And she said, I said, how much gabapentin have you given? And she's like, I don't, she's like, how much do you want to give it, Andrea? And I said, well, I think I need to do like 300 at night and 300 in the morning of. And she's like, no, that's what you need to do. I was
Mhm.
like, all right, all right. And so, and it worked. That poor cat probably just slept for like 3 days, but we got it done. And it was important to get it done. But, so I found most of the kitties, though, they're probably getting somewhere around 100 the night before and 100 the morning of.
The morning of.
Yeah. Before kind of knowing about gabapentin, there would be times when I would send home a couple doses of buprenorphine
Mm,
and have them give the buprenorphine, just,
yeah.
saying, okay, it's pretty safe.
Yep.
It's something where I'm going to see you tomorrow. And that was, for me, something that was easier for me to do that wouldn't necessarily have any sort of hemodynamic effects on the cat when I'm
Right.
doing an echocardiogram. And what's nice about,
Right.
again, going back to the gabapentin, is that somebody has actually studied and looked at echocardiograms, being on
Mm-hmm.
GABA and not. And thankfully,
Mm-hmm.
it really doesn't affect us being able to get a blood pressure on the kitty and, getting something
Yep.
accurate. Um, and then there's the ones where you just don't know that they're that mean before they come in and or opinionated. And, that's where, I really like Torb. So butorphanol has been
Mm-hmm.
kind of my go-to when
Go
I'm
to.
using it. It's just, thankfully, it's a good enough sedation for me. I would say the only time where I'm going to avoid that, obviously, is going to be an animal that will need actually really good pain control for, say, a sample
Mm-hmm.
thrombus or something. So that's not going to be my go-to. I'm going to go for more of a true mu agonist. So, yeah.
Okay. Good. So, just like you said, even you sometimes prioritize what you need to
Yes.
look at when you're looking at the heart. And so, in this case, echocardiography was performed and there was concentric hypertrophy, and then there was this left atrial thrombus. And so, I read about kind of like this spontaneous echo contrast or smoke. What does that look like, and why should it matter if we see it?
Yeah, so smoke actually does. It looks like somebody just made a little fire and there's smoke coming out of your little campfire. It does. It looks like it's swirling of the blood components, and it
Mhm.
is. It's kind of like a lava, not really lava lamp because that's kind of bubbly, but more of a like swirling. It's pretty, but it's scary. And so, but it really does. It looks like you have just like swirled a bunch of, smoke in that left atrium or that left auricle. So, and that's where, with us as cardiologists, sometimes the left atrium, the body of it won't have the smoke, but the auricle will, which takes a different type of basically echo view to get the auricle, and it takes some pretty serious practice in getting that view. And so it's something that we get it in all of our kitties, just because it's something where that is that appendage can have just basically slow flow. And so it's something where we'll get velocities of flow in there, because the slower the velocity, we have normals. And so if it's too slow, they're at a higher risk of developing spontaneous echocontrast and a thrombus. So yeah, I mean, it's very descriptive. It looks like smoke.
It looks like smoke.
Yep.
So this case was staged as B2 hypertrophic cardiomyopathy with an obstructive phenotype, which is kind of a lot of words.
Yes,
For
sure is.
clinicians that can be just less familiar with how this staging works, can you just briefly kind of explain just what does that mean in practice?
Yeah, so when it's a lot like the dogs with mitral valve disease, and so with the B ones, it's basically these are the kitties that have evidence of hypertrophy. So whether that's just a segment of their cardiac muscle, whether it's concentric, it might just be their papillary muscles. So they can have all these different phenotypes that we see on echo. But they don't have a big left atrium, and really they are, when we kind of decide how high of a risk are they for, heart failure or developing a thrombus within the next year, those are the ones where they're at the lower end of the risk. Certainly we have those that kind of go from 0 to 60 in a year, but most of them are, they stay pretty stable for years. Then the B2s are when we start to see typically left atrial enlargement. So that's where we're doing that. When you see on our echo reports, we do an LA to AO. And if you're looking at that number, it shouldn't be more than 1.6. And so if you're starting to see 1.8 and 2, that's big. The other that's important to remember too is that we're also looking at the function of the left ventricle as well. So we're looking at, are there areas that are hypokinetic, meaning that they're not moving the way that their friends are moving, or they're not moving at all? Do they have any areas that we're worried about that might be infarcted? So do they have kind of almost what we would look like as you'd have some hypertrophy and then some thinning out of the wall, and it would be very hyperechoic, meaning bright on the echo. So those are also things we're looking for too, to say, hey, you're not just a B1. You've got more risk factors than just a kitty that just has a little bit of hypertrophy. So that comes to the, just basically looking at all the segments of the wall and making sure that you don't see anything there that puts that cat at higher risk. And then when we get to C, that means they're in heart failure. So that is basically them, whether it's they've got some pericardial effusion or they're pleural pericardial pulmonary edema. So, and that's when you're going to need to initiate, therapy with a loop diuretic. And then D means that they are refractory typically to the given loop diuretic. And so you're having to do all sorts of just different creative approaches, or you're switching from, if you have them on furosemide or Lasix, you're switching them now to torsemide, which is a 10 times more potent diuretic. So the D's are, kind of like that end stage and more refractory heart failure.
Yeah, that was helpful. Thank you.
Yeah, of course.
The presence of left atrial thrombus, it does carry increased risk of sudden death. So I just kind of wondered, you've said a couple times when kitties are opinionated, which I absolutely love. I use that language with clients all the time, and I find that they're really receptive to that. So I just had to say, I love that you say that, because I say it too. And that's kind of, how do you approach conversations with owners about living with that uncertainty? Because that's another place where I think clinicians really, can sometimes struggle, and we need to be able to remain positive but set realistic expectations.
Yeah, absolutely. So my approach, which is just my approach, is I tell them, look, we're gonna talk about some scary things right now, and things that that I have to deliver to you in a compassionately honest way. So I want you to know that I'm not telling you these things just to scare you. I said, but I need you to know that these are the risk factors, especially families that, if there's like kiddos involved, because that can be quite traumatic. And so for adults it's traumatic, and for kids as well. And so I start with that. I said, we're going to talk about them. I said, but then after that, we I'm not going to belabor the topics. I'm not going to sit here and be, sullen. We're going to talk about what we can do. I said, but I do need to tell you these things because it's only fair to you, and that's why you come to me. And so, and then I kind of say, okay, we're going to start with the risk of heart failure and what that looks like. And then we're going to talk about the risk of, if they haven't had a thromboembolic event yet, or that we haven't seen, then we talk about what can that look like? It could be a forelimb, it could be a hind limb, both hind limbs. It could be weird mentation because sometimes they throw thrombi to their brain. So, I said, and I usually tell them, look, any hiding cat in a weird hiding place, that's, for me, that's always a problem. So let's look for things because cats can be quite subtle in their clinical signs. And then I just talk to them about, risk stratification with respect to sudden death. So these kitties that do have thrombi and their disease is significant enough, they're obviously in that higher risk category for sudden death. And I give them examples of what owners have told me when they have found their own kitty. And I said, typically it's quick. And typically you don't even know. It's like one moment to the next. I said, but it can happen. And I have some owners that very much have a very emotional response, understandably, because this is not an easy conversation. Then I have some that say, you know what, I guess if I had to choose, if my little beloved pet had to go, if it was quick, then at least I know it was quick, and that's like, absolutely. I said, it's very much a philosophical, conversation, but it's something where that definitely takes more time. And oftentimes it will kind of hijack my day, but it's fine because it is a very important discussion. And most of my owners that are coming behind that appointment understand when I say, look, I had to have a pretty tough discussion. So, but it's not easy.
I think that's a great point too, is just being open and honest with everybody on the team or the next people.
Yes.
Hey, we had a tough morning. Let's give everybody a little break, a little breath,
Yes.
a little grace.
Absolutely. Yeah. We need more of that in our profession for sure, where it's like, let's just take a moment. Like, all it takes is actually a few minutes just to debrief and say that was hard, and it's hard on me too. Like, I'm not immune to it. So I know how you feel. So, yeah.
Are you on track to hit your CE goals? Clinician's Brief has more than 60 hours of practical, race-approved CE, perfect for catching you up and keeping you up on requirements. Whether you prefer to read, watch, or listen, Clinician's Brief CE is on demand and always affordable. Start earning CE today at cliniciansbrief.com/CE. Okay, so we talked before the break all about diagnostics, low stress handling, how we came to this diagnosis for your case. Now I'd like to talk a little bit about treatment. Okay, so the cat in this case was treated with both clopidogrel and rivaroxaban. Can you explain the rationale behind using these two medications in combination?
Sure. So most, as you guys are very familiar with, most of our kitties, when we start a antithrombotic, we're usually using Plavix or clopidogrel. With this kitty, because there was an active thrombus, I was really worried that that might not be enough. And so the typical kind of standard of care, especially for our kitties that come in with let's say a saddle thrombus or a forelimb thrombus, is to start them on an actual factor 10A inhibitor. So basically, without going into everybody's probably darkest days in veterinary school, but when you're looking at the coagulation cascade, that and the Krebs cycle.
The Krebs cycle?
Yeah. Where you're looking at the convergence of those houses is where you're going to be basically inhibiting, further clot formation. And so I'm not going for basically a clot buster at that point. I'm just basically telling the body, hey, let's not make more of these, and allow the body to have its natural mechanism for kind of taking care of the current thrombus. So, and thankfully they're safe. Thankfully they've been studied to be shown that they are safe. I do talk to owners about, look, if you ever see any abnormal bleeding, just because even though I tell you it's incredibly safe and you shouldn't see abnormal bleeding, please don't, if there's ever blood in the urine, if you ever see anything in the mouth, anything, please let me know, just because, there is the possibility. I have some, it's crazy to me, but I have some owners, I have two because they stand out in my head, that just insist that the cat has to go outside, and not just like go outside for a minute, but like actually, so we have your animal on blood thinners. So we should keep the kitty inside, and they let that cat go outside. So, but the rationale behind it is I'm working at two different basically systems to hopefully prevent further clot formation, and then allow the body to kind of, for lack of a better term, like eat up that that current thrombus in a very kind of slow manner, so that we're not basically doing any harm towards them, but helping to kind of help resolve that.
And generally, these medications are continued long-term, maybe even lifelong. Kind of brought up a point in the article. So if as a general practitioner, I have a cat that's on some of these medications that I do want to do maybe a dental cleaning or something like that on, what precautions should I be making sure that I take when I'm managing cats that are on like long-term anticoagulant therapy?
Yeah, so everything from like a blood draw, I usually just say, and it's in all my communications with the veterinary team that's with the general practice, and saying, hey guys, whenever you do, especially if I'm not telling you can't do a jugular stick, but if we're doing something like that, we need to make sure that we're holding off for longer, and I say in general, like 10 minutes is plenty of time to hold that off. But just making sure that, that everybody's aware that what the cat's on can cause them to just kind of ooze and bleed a little bit more. If they need a procedure, ideally we would have them take a little holiday for about 7 days before they have a procedure. So if it's something where we just don't have that option, say it's something where it needs to be addressed right away, you've got some sort of, my own cat jumped from the staircase and like smashed her face and broke her canine. I thought for sure she had a squamous cell carcinoma, but she just was clumsy. And the dentist at the time was like, we probably should do this today, Andrea, because that looks like it really hurts her, So that scenario, what's going to happen is that it's going to probably just take you longer, because you're going to have some oozing and more blood that you're used to. But it shouldn't be anything like, massive. It's going to take longer just because it's going to be messier. So, but usually I'll just have them, hold for about 7 days before a procedure.
Okay. And it's okay to just stop them abruptly? You don't need to taper them?
Yeah, you can just stop them. And because they have such a once they build up in the system, they have such a long half-life that it'll kind of just naturally taper. So
taper on its own. Perfect.
Yeah.
Excellent. Another medication that was used in this case was enalapril, but you kind of mentioned in the article that the efficacy in cats isn't fully established. So what led you to include it here?
Yeah, so this comes very much to knowing that, if you're a purist with respect to the literature, which we all try very much to be as, diligent and, stewards of kind of going by, okay, what's the data? There are just times I've seen with my kitties where I worry about their left atrial pressure being so high, and I can see that on echo. I can say, oh gosh, this is exceedingly high. You're not in heart failure yet, but we do know from older studies that if you give an ACE inhibitor, it does reduce left atrial pressure. And so there are times when I will use it. It's not certainly it's not like every cat that I see it's a B2, I'm going to stick them on an ACE inhibitor. But for that particular cat, the last thing I wanted was this cat going into heart failure in the next week. And then, that could be a big decision for those owners, especially for the expense of having to hospitalize and get them through that after they've just been through this and they're buying expensive medications. And so just trying to do what I could to reduce that left atrial pressure. But you could argue the kind of cellular mechanism of why it might be beneficial. But yeah, the literature is very much where you have some retrospective studies that seem to think that, oh gosh, yeah, it looks like it. John Rush did one where it's like, looks like it might be helpful. And then other studies where, people, nope, it's not helpful. So it definitely is a case by case for me. And even just letting the owners know, this is why I'm using it. And if your cat stops eating, or if we're, worried that the medication is making, typically that's what I worry about. If they stop eating, then we'll take that away, just because that is the number one side effect from that drug, is that it will affect their appetite, and none of us want a cat's appetite to be affected. So
that's a little bit where that art of practice comes in, and just
that's right.
personal experience. And so
exactly.
What about beta blockers? Should beta blockers like atenolol ever be considered in cases like this?
Well, I would say cases like this with this kitty, I wouldn't have used a say atenolol or a beta blocker with this particular kitty. Where they perform the best is kitties that have such a severe degree of obstruction. These are usually your kitties that have like that grade 4, almost a 5 left parasternal systolic murmur. They've just got a ridiculous amount of obstruction from their mitral valve basically being pulled into their outflow tract. Some of these cats will faint and be exercise intolerant from the outflow tract obstruction. We always have to make sure that they're not having an intermittent arrhythmia too. So some of these cats will get holtered as well to make sure that they're not like having episodes of VTAC. And so for those kitties that have the kind of more severe obstructive form of hypertrophic obstructive cardiomyopathy, that's where the atenolol performs the best. It's also a nice drug too when you do have a cat that's throwing quite a few VPCs where it's like, I'm uncomfortable with this. This is not just like 1 or 2 in the last hour. This is like several each minute. And so atenolol performs quite nicely in cats in that scenario as well, where you want to use something, and atenolol is just nice because it's a nice dose. It's usually a quarter tablet once or twice a day, and it's not bitter. And so typically kitties will take it pretty well. We used to, like years ago, think, oh gosh, what if we gave all these cats with HOCM or hypertrophic obstructive cardiomyopathy, would it make them live longer? And there's actually a study that shows it doesn't. It doesn't change their biomarkers. It just, unfortunately, it doesn't perform well kind of to delay, clinical signs, or, delay progressive disease. So it is definitely a case by case choice for those kitties. And usually those are the scenarios. So kitty cat that is exercise intolerant or fainting due to the outflow tract obstruction, or cats that have a ventricular arrhythmia where I'm like, I need to do something about this because it's kind of ugly. So.
And then what about like pimobendan, or even the newer conditionally approved sirolimus? When should clinicians consider initiating those therapies?
Yeah, so it's funny. The most recent data on pimobendan is sadly not as great as we would hope for kitties. It's obviously wonderful for dogs, like it's just wonderful. But for cats, it doesn't seem to perform as well. So we used to, we know it's safe. So that's a good thing. So if you're giving it, it's safe in cats. It just doesn't seem to really impact, survival time, or even necessarily getting them out of the hospital when they're in heart failure. We used to think, oh gosh, well, if they're hypotensive, if we give them some vetmedin or pimobendan, we should be able to, get them out of the hospital sooner. But it just doesn't perform that well consistently. And so that's where the power of the study helps a lot, just to know that, because all of us as feline practitioners the least amount of meds that we need to give these cats. And I wish it performed wonderfully, but it just doesn't. So it's not something I'm really reaching for my cats, with respect to their overall kind of long-term treatment. They would need to perform better for me to commit an owner to that. The conditionally approved sirolimus, which is felicin, there's promise there, is what I'll say. And so it is very specific for its indication. So it is something where, of course, I'm going to feel strongly about this because I'm a cardiologist. So I'm just going to say that. But it is something where we're having to be able to say on the echocardiogram, you are truly a stage B1 and maybe a B2, but like not like B2 almost a C, and they have to be cats that don't have like other conditions that might complicate things. Like it is a medication that's, potentially immunosuppressive, even though, when they looked at vaccine response, that thankfully that drug does not seem to interfere with the vaccine response. So how we're giving it at once a week at a low dose, thankfully it's has a safety profile that we feel comfortable with. But it is something where you need to be careful with it, just because it's not like every cat with a grade 4 murmur should probably go on it at this point until we know more about cats with more significant disease. So I definitely have some owners that their cat's in heart failure and they're like, please just give me the felicin. I'm like, you don't want to. And we don't know yet. We don't know if it's going to hurt your cat. So I'm not your cardiologist for that. And so, but for the kitties that have more that stage B1, how I've been using it with my owners is to tell them, look, we're going to have more data on this drug. Basically it became available to us prime time just this late summer. Mm-hmm. So, as more cats are put on it, we're going to know more about it. But I do have some of my patients that are receiving it, particularly those where I whether it's a gut feeling or whether it's just experience of seeing these cats where I'm like, I need to do something for you. And you are the cat that if you were my cat, I would be giving this to you. There are some kitties that have, like tiny little focal hypertrophy where, we know that in general, most of them are going to live years with that little tiny bit of focal hypertrophy and not have a problem. But I do talk to all my owners that are that stage B1, even into the B2s, about sirolimus. And so it is, though, based upon an echocardiogram. And so it's hard for me, for you all in general private practice, mm-hmm. just because right now it should be something that's given after they've had an echo diagnosis that's very, like basically, nope, this is what you have, and we're going to follow up. So it takes dedicated owners to say, okay, typically what we would recommend is in 6 months we do another echo. It's a medication that can cause an increase in liver values. And so you want to make sure that first that their liver values, like their ALT is in the normal range before you start the medication. The company recommends in 2 to 3 months after they've been on the sirolimus that they get their like a liver panel performed again. So that's what I usually do, is in about 2 months we do another liver panel. And then typically every 6 months, they're going to get a liver panel while they're receiving the drug. There's some thought that potentially these cats don't need to be on it, like say for the rest of their life, like in the initial period when we were learning about it, like in my head, I was like, oh, these cats are just going to be on it for the rest of their life. But mm-hmm. there's some thought process that maybe they're on it for a period of time. There's a benefit from it where their cardiac muscle thickness gets basically, we go from a muscle wall thickness that is abnormal to something that is maybe not normal, but better. Mm-hmm. And we may be able to take them off of it. But I know that we'll know more again as the HALT study continues. And then as more and more kitties are on this medication. But those are like the big things. I would say most of my owners, I just let them know that beyond cardiac signs that I want them to look for is that sometimes this drug can cause GI side effects too. So so some of my kitties that are more sensitive tummies, I just say, hey, look, you're going to give it once a week, and so just let me know if you notice a decrease in appetite or any other GI signs. With respect to the liver values, so one of the questions always is, so what if the ALT jumps up to 2 or 3 times like the high end of the normal range? That is obviously when you would take them off the drug. So the company says if you're 2 times higher than the normal, like that endpoint normal range, that's when you would discontinue the drug. When they looked at these cats, they didn't, they basically had blood values that went back into the normal range. And then some of the kitties that we were able to look at their liver later, their livers were normal. They didn't have any like actual permanent damage to their livers. So that's also why I tell the owners, like, hey, when we stop it, but thankfully there's not this huge risk for them to have like liver failure afterwards. So, which is important, because, a lot of, people are like, I don't want something bad to happen to another organ if we're already dealing with this one. So,
yeah. No, that's very encouraging.
Yeah.
Calling back kind of to the top of the episode, where I had said there's really kind of this large range of possible outcomes. Are there any reliable prognostic indicators kind of at the beginning of the case that you look for at the time of diagnosis to help kind of guide clinicians, as well as that conversation with the owner about, are we going to just be dealing with one of these lifelong subclinical disease kitties, or, are we more worried about real progression to, some of the more scary outcomes like the sudden death?
Yeah. No, I would say, so with this particular, with say like saddle thrombus, like kind of taking that extreme, really the number, like what, and this is just from literature from a while ago, but really what we look at is their body temperature when they arrive. So the lower your body temperature, so if you're like a 95-degree kitty cat, the likelihood of you being able to survive this event is much, much, much lower than if you actually have a normal body temp, which makes sense, that just kind of gives you a perfusion kind of indicator. With the cats with, say, subclinical disease, and we're looking at these kitties, say, without an echocardiogram, but we're able to get, we were able to say, okay, their NT-proBNP is abnormal. And then especially if you guys are able to get chest x-rays on them, those that, as you can imagine, this is, you're probably like, yes, of course, Andrea, but if their heart's big, those are the ones obviously I worry about more. Like those are kitties. Yeah. Can they live like that for a while? Absolutely they can, but I'm going to worry about those guys more. They're just going to be at a higher risk for all the bad things, versus the kitties that are more like you hear a murmur, and say maybe you hear like a grade 2 or 3 and you take an NT-proBNP and it's elevated, and you're like, it's elevated and there's nothing else that's causing it to be elevated. Like you're not hyperthyroid, you're not hypertensive, you don't have chronic kidney disease, because that's how it's cleared, is through the kidneys. And you take thoracic radiographs and they look pretty, like, you're like, those look pretty normal. Those are ones where, not to say I wouldn't worry about them, because of course we don't have crystal balls, but they're obviously, those are the ones that I would say, if you were to say, which one should I recheck in 6 months versus a year? Obviously the former would be, let's recheck you in 6 months. Let's kind of just make sure that we're not hearing anything weird, that you're, as we interrogate you on your on your history, that you're not telling us things that make us a little bit scared, like your cat's hiding, or every once in a while he breathes a little heavy after you does the zoomies. And then the latter kind of scenario would be, it's reasonable to say, hey, we'll, recheck things in a year. And maybe at that point, if you can maybe save up some money for an echocardiogram, that will be helpful, just because we'll be able to see kind of more of the finer details of things. So I definitely have, even with my patient population, of like, okay, here's my kind of standard protocol of like when I'm going to recheck. like my stage B1s typically a year, my B2s every 6 months. But I have some of my owners that whether they live far away or just financially, every 6 months is hard for them. I do have them. I'm like, look, here's some alternatives where we can do the NT-proBNP. We could, if at that point in time everybody feels comfortable with doing some chest x-rays, I'm happy to look at those, just so that way we have another point in time with another veterinarian taking a look at your kitty, knowing that you're at a higher risk for, the bad things. So, yeah.
Well, that's good. And that really answered my question about, how often we should be rechecking these guys and monitoring them, and what are we really looking for to assess our response to treatment. I guess my final kind of question is, when I was getting ready for this episode and doing a little homework, on things, I found some prevalence studies that said up to 15% of cats may have hypertrophic cardiomyopathy. I mean, that's a big number. So, but this case had a positive outcome. So what kind of message of hope do you think that general practitioners like myself can take away from this case when it comes to like early screening and early recognition of this disease?
Yeah, so I think my hope in general, obviously all of our hopes in general, is that sirolimus is going to be like a game changer for us. Like truly, I know, there's hope there for sure. In the kitties that, if we kind of went to the extreme of say thromboembolic disease, just because this is what this kitty came in for, is that those kitties that actually have a forelimb thrombus, not the hind limbs. Those, I also counsel my ER doctors and say, hey, those are ones even, I mean, none of us want to be like treat and street those kitties, but even say an owner that is financially, that just, they can't keep them in the hospital to watch them. If you give them good pain management and we get them onto at least an antithrombotic, those kitties actually can do quite well and, can live years. And then there's the variable response of the saddle thrombus. So this, like we talked about, a cold kitty that, and especially, all the other things, like, are they in renal failure, are they in heart failure, like those are all going to add on to the prognosis. But I would say in general, a lot of these kitties that we do see are, at that kind of B1, maybe B2, and they can live years. So it's something that it's not, we know from the human literature as well that people live with this disease. It just means we have to take into account, and that's why I tell my owners, like, you have to take it into account when we're doing general anesthesia or certain drugs, which could be another like 2-hour podcast probably on corticosteroids. But, and like, it doesn't mean that you can't have them. It's just like, we're careful, and so that way they know, and just even knowing what to look for. So that way we can catch things sooner and keep them from having to be hospitalized, and, making it so that it's easiest on them.
Well, this was a great conversation. And if you want to come back and do another 2-hour podcast on corticosteroids, we would love it. But before I let you go, if you have just a little bit more time, I didn't know if you'd want to play a little game with us. We end our podcast typically with a little, just for fun, kind of would you rather questions that are just, that I just throw out at you and you just give me your answer right off the top of your head.
Oh my gosh, sure.
Okay. All right, here we go. Would you rather perform a cardiac evaluation on a dolphin or a hummingbird?
Oh, that's a good one. Dolphin.
Dolphin? Yeah.
Yes, yeah.
Even with the whole, like, the water and...
Yes.
Okay. If you were at a party and people started chatting about their pets, do you admit that you're a veterinary cardiologist, or do you pretend you work in a different field?
I typically admit that I do because, because I
even
do
though
love
the
what I do.
pet
Yeah,
questions
I
start
know.
flying.
I know, but you know what? Then people just talk, and I don't have to talk typically.
Okay. If you could snap your fingers and instantly eliminate one, would you rather eradicate heartworm disease or myxomatous mitral valve disease?
Oh gosh. Heartworm disease. I have to
Heartworm.
say.
Yeah.
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 Yep. It's just bad. Yeah.
It is. It is.
It's just
Luckily,
really
I'm in
bad.
Vegas and I just don't see a lot of it
Oh yeah.
because we don't have a lot of mosquitoes, but
Right.
who knows? That's changing.
I
You know,
know.
where heartworms popping up in places we have not seen it before. So
Yes.
I'm with you on
Yeah.
that. I don't want to do
Yeah.
it. I left that in Iowa.
Yeah. No, it's not
So,
fun. I know.
all
Poor
right.
people. Yes.
2 more quick questions. Would you rather have to give all of your discharge instructions with like Pictionary style sketches or act them out like charades?
Oh, probably act them out like charades.
Act them out? Okay.
Yep.
Excellent. I like to draw, so I'd probably like
Yeah.
I'd put the big circle and the heart in the middle with the waves around it for
Yep.
pericardial.
Love it. I love it.
All right, last question, and this one is very serious, so I really want you to think about this.
Oh, shoot.
If a centaur came in and needed an ECG, would you put the leads on the man's chest or the horse's thorax?
Oh my gosh. The horse.
I agree, because like
Yes.
that little man heart isn't going to power that whole body. There's no
No.
way.
No way.
All right. Well, that was it. I hope you had fun.
I did. No, it was so
Okay.
lovely. Thank you.
Thank you so
Yes.
much for joining us. Really, truly, we really, really did love it, and I'm serious about that offer to come back. Thank
Oh,
you,
I'd love
everybody
to.
at home, for listening. We'll catch you next time.
All right. Thank you all.
Thank you for listening to Clinicians Brief the podcast. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcasts on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@instinct.vet. Clinicians Brief the podcast is an Instinct Science production, produced by Alexis Ussery and hosted by Alyssa Watson.